We're seeing so many changes in the post-acute space right now. We're seeing more and more facilities from a post-acute standpoint that are caring for sicker and sicker patients. This sort of downstream impact of where patients are being discharged out of the hospital sooner. They're in skilled nursing centers, they have multiple comorbidities. And these facilities, the staff and the leadership are trying to figure out how do we care for these folks and provide that best-in-class service. So if you think of APS, Advanced Pharmacy Solutions, we are the only remote dispensing technology that's geared towards post-acute. What we do is we bring the pharmacy to the facility. So our technology is actually in the facility. It connects into the EMR system within the facility. So everything the patient needs from a medication standpoint is updated in real time, right? There's no delay in care. So think about it, if you're a patient who's being discharged from the hospital, and it's a Friday at 6 o'clock, okay? And you need that first dose of medication, we have the only technology that's on site in the facility to be able to meet that need. There's so many things that our technology brings to the facility. We save the nursing staff so much time. There's no shift-to-shift med count, okay? We're only dispensing what the patient needs for that particular med pass. There's so much time that nurses can be back at the bedside taking care of the patients and what they need. We remove waste from the system. On average, when our solution, our technology is in a facility, the patient uses 8 days less of medication per month. We also can work through the technology and set up your medication formulary. So the machine, the technology allows us to have certain medications that flow through the technology that can be the most cost effective with the same efficacy that the patient needs. Another great thing about our technology, one of the most important pieces that we built into this, is to make sure that our accuracy of medication administration is best in class. And our accuracy rate of dispensing is 99.9998 in terms of making sure we have the right medication for the right patient at the right time. Tremendous benefit that APS brings. There's so many skilled nursing centers that are challenged with making sure that patients don't rehospitalize unnecessarily, right? That they're able to provide those care services within their community. If you think about what APS, it's a huge solution for that, right? Bringing the pharmacy services to the facility, having those on site, having access to those life-saving medications in real time. From the studies that we've done at this point through our technology, is that we can reduce your rehospitalization rates up to 2% just by making sure that that medication is there timely. In most cases, that's the number one reason why patients are readmitted, because they don't have their medication timely. What's so great about this upgraded version of our remote dispensing technology is that we have one software system that's cloud-based that connects all the different machines together. It's easy to use. We went from 14 clicks to actually have the technology do a med pass down to 4. So this user interface that we have that is so easy to use, what we're so excited about is that as a skilled nursing provider, you're going to have access to so many different reports and analytics. If you think about how we manage the medications that we're providing to residents in our facilities, this is the first technology that allows us to look at that spend, look at that management of it, make sure that we're providing the right medication at the right time to the right patient. What's the cost of that? How do we be more efficient? So all of those really important dashboards, analytics, leadership in every one of our facilities will be able to use this technology to look at their operations in a completely different way as it relates to the pharmacy piece of it, which has never been done before.